Hello guys, so this is going to be the fifth part of our series, and in this we are going to further discuss some important questions related to RRB examination. So let's begin. So the first question here says, what is the primary principle behind the blood path integrity test in dialyzer safety and checks during automated reuse? So it is asking us the principle behind the blood path integrity. So option A says to know fiber bundle volume. Option B says to avoid blood leaks. Option C says to avoid air embolism, and option D says to find KT by V. So the answer is to avoid, yeah, to avoid blood leaks. Uh, the blood path integrity test checks whether the dialyzer fibers are intact before reuse. If there is any rupture in the fibers, blood could leak into the dialysate during the treatment. This test ensures patient safety by preventing blood leaks and cross contamination. Um, the blood path integrity test has direct connection, no connection with the KT by V, so this option is wrong. To avoid air embolism is also not connected to the integrity of the dialyzer. It is generally caused when there is some uh, loosening of the connections, mainly the venous line. So it is also not right. So the answer is the option B, to avoid blood leaks. Moving ahead, the second question says, why is lowering beta 2 microglobulin levels important in dialysis patients? So beta 2 microglobulin levels should be less in patient, and why is it so? So option 1 says to prevent clotting, option B says to lower morbidity and mortality, option C says to improve fluid balance, and option D says to reduce infection risk. So the right answer will be to lower the morbidity and mortality. Since beta 2 microglobulin accumulates in long term dialysis patients and can cause dialysis related amyloidosis, leading to joint pains, bone problems, and systemic complications. Reducing its levels improves long term outcomes and reduce complications, thereby lowering morbidity and mortality. There is a separate video we have made on beta 2 microglobulin. You can also watch that, and you can see, I guess, over here in the icon tab, and there will be direct link to that video. Moving ahead to the third question of this part, here it says, what is the primary renal lesions found in both chronic analgesic nephropathy and heavy metal nephropathy? So primary renal lesions which are found in chronic analgesic nephropathy and heavy metal nephropathy. This question is from the pathology part. So option A says chronic interstitial nephritis. Option B says glomerulonephritis. Option C is acute tubular necrosis, and option D is renal artery stenosis. So the answer here is chronic interstitial nephritis. Both chronic analgesic abuse and heavy metal exposure damage the kidneys, interstitiums, and tubules. This leads to chronic interstitial nephritis, characterized by fibrosis and tubular atrophy, rather than primary glomerular disease. Moving ahead to the fourth question, it says, which medical which medication is commonly used to treat hypotension during dialysis? So if a patient on hemodialysis develops hypotension, so what we are going to administer, or what medicine we are going to give to that particular patient? So first option is furosemide, option B is spironolactone, option C is midodrine, and option D is metoprolol. So the answer will be midodrine. Rest all are diuretics. And what we know, let's see the explanation first. Midodrine is an alpha agonist that increases vascular tone and blood pressure. It is commonly used in patients who develop recurrent intradialytic hypotension. However, diuretics or beta blockers would worsen hypotension. So why will we give diuretics or beta blockers to patient who is already in hypotension? It is going to worsen his or her situation. So that's why we have terminated all these options. Moving ahead to the fifth question of this part, it says, according to Army standards, what is the maximum allowable total viable bacterial count in water used for hemodialysis? So, according to Army standards, what is the maximum allowable bacterial count in water used for hemodialysis? So, the answer is 200 CFU. According to Army standard dialysis, water should have to be bacterial count less than 200. It should be less than. Higher level increases risk of pyrogenic reactions and infections. For ultra pure dialysis, limits are even stricter. So it's a factual, and you have to remember this. The standards should be remembered by you. The guidelines. It has particularly ranges, and the ranges for HD water, or so you can say dialysate water, is different. For ultra pure water, it is different, and for feed water, it is also different. You have also you also need to remember the action levels. So these are some values that you have to keep in mind before you enter the examination hall, because they are factual information and you should remember that. Moving ahead with the sixth question, during plasmapheresis, calcium monitoring is essential due to risk of what? So in plasmapheresis, calcium monitoring is very essential. Why? Option A is citrate induced hypocalcemia. Option B is hyponatremia. Option C is hypokalemia, and option D is hypophosphatemia. So answer will be citrate induced hypocalcemia. Why? Citrate is used as an anticoagulant in plasmapheresis. Citrate bind calcium in the blood, reducing ionized calcium levels. So whenever we use citrate as an anticoagulant, there is always a risk that the calcium might remain bound to the and reducing calcium levels in the systemic blood. So this can lead to hypocalcemia symptoms like tingling, cramps, arrhythmias. So calcium monitoring is very essential in plasmapheresis while we are dealing with the citrate part, or using citrate as an anticoagulant. Moving next, the question says, how often should the cleaning solution in a surface cleaning machine be replaced in dialysis unit? So what should be the time, or what should be the practice? So option A says after every shift, option B says once a month, option C is every day, and option D says once a week. You mark your answer on your notebooks, and the right answer is option A, that is after every shift. Cleaning solutions used for dialysis unit surface cleaning should be replaced daily to maintain effectiveness and prevent microbial growth. Using old solution reduces disinfection efficiency. So whenever this type of question is asked, you have to remember cleaning solutions in a surface cleaning machine be replaced daily. Moving ahead, the question 8th, it says, which method helps to avoid the impact of excess recirculation on urea reduction ratio or single pool KT by V during dialysis? Option A says increasing dialysate flow. Option B says slowing the blood pump below excess flow rate for 10 and 20 seconds. And option C says drawing blood from the venous line, and option D says stopping the blood pump immediately before blood sampling. So the right answer will be option B. And why so? Because before taking post dialysis blood samples, the blood pump is slowed briefly to allow systemic blood to mix and prevent recirculated blood from affecting the results. This ensures accurate urea reduction ratio and KT by V measurements. So basically why it is done, so by this we actually allow the systemic blood to mix Otherwise, only the purified blood will be there, and that will obviously affect the results. um, we will get overestimation of the result. Moving ahead to the ninth question, it says, what is the primary purpose of disinfecting dialysis machines according to the manufacturer's recommendation? Option A is to reduce treatment cost. Option B is to maintain dialysis temperature. Option C is to improve dialyzer efficiency. And option D is to prevent growth of bacteria and endotoxin in the hydraulic systems. So this is very easy, I guess. To prevent growth of bacteria and endotoxins, we particularly use disinfectant in dialysis machines. So the explanation part, dialysis machines have internal fluid pathways where bacteria and endotoxins can grow if not disinfected regularly. Disinfection prevents the contamination of the dialysate and protects patients from pyrogenic reactions and infections. Moving ahead to the last question of this part, it says, what is another term for brand name of a drug? So this question is from the pharma part. So it is asking another term for the brand name of a drug. So option A is trade name, option B is scientific name, option C is chemical name, option D is generic name, and the answer is trade name. So a drug brand name is also called its trade name. Example, we can take Crocin. Crocin is a trade name for paracetamol. The generic name refers to the chemical compound itself. So this was all about uh, this video. We have discussed 10 important questions which have been previously asked in the RRB. Hope you are enjoying this series. Make sure to like this video, and the practice sheet will be available in the Telegram group. So make sure you join that group and practice the questions which have been discussed here by yourself. And more questions are coming, and I will try to post regularly. Okay, thank you.